Our group presentation is on selective mutism. What is selective mutism? Selective mutism is a severe complex anxiety disorder where a person or a child is unable to speak or communicate in certain social situations. This includes at school, with relatives, or in social gatherings. It usually starts during childhood and if left untreated can persist into adulthood. These children are able to speak and communicate in settings where they are comfortable, secure, and relaxed. Some key aspects of selective mutism. Individuals with selective mutism may present with social anxiety and social phobias. Some symptoms of social anxiety and social phobias may include the following: lack of eye contact, clinging to parents, hiding, running away, crying, freezing, tantruming if asked to speak publicly, avoidance of eating in public, anxious when having picture or video taken of them, anxious to use public restroom. In addition to these features of social anxiety, children with SM avoid initiating and participating in conversation. They're only able to express themselves and may rely on only gesturing, nodding, pointing, or whispering. Most unlikely, they may have fears of being ignored, ridiculed, or harshly evaluated when they speak.
Selective mutism was first discovered in the 19th century by the German physician Adolf Kussmaul. Its original name in 1877 was aphasia voluntaria, which described the condition where individuals would voluntarily not speak in certain situations. In 1934, this name was changed to elective mutism, which was emphasizing the elective or voluntary nature of the persistent failure to speak. This was later changed in 1944 to its current name, selective mutism. This name was chosen to represent the failure to speak rather than intentionally not speaking, as its previous name had suggested.
This slide is about individual impact on the person with impairment, which is selective mutism. I came across an article that talked about a woman named Catherine Harper. Catherine Harper, an author-illustrator, suffered with selective mutism a lot during her childhood years and discovered her issue when she was older. She'd get questions like, "Why are you always quiet?" or "Why don't you talk?" But no one knew how hard it was for her to actually answer simple questions or to engage in a casual conversation. As a kid, she couldn't understand why she felt the way she did whenever she tried to talk. People just assumed she was shy or stuck up, which is the case for most people who have selective mutism. She explained that trying to speak caused, quote, "my emotions would bubble up and threaten to take over, as my rigid body stood in shock, with wide eyes staring into nothing in particular. The words would just echo over and over and over until it felt like thousands of people were standing around me, each of one of them demanding an answer. At the same time, my world would slow," quote. No matter how much she did want to talk, selective mutism just held her back terribly. Catherine was okay talking in settings where she felt comfortable, like at home or with close family and friends. Eventually, she did learn how to cope with it better as an adult, although it still can be difficult to speak. Catherine realized that as long as she recognizes her growth and how far she's come with her selective mutism, that's all that matters.
Okay, so I'll be going over the medical responses to selective mutism. About 1 in 140 young children are affected by it. Selective mutism is seen more in children and adolescents than in adults. And currently, there's only a few medical reports and research on selective mutism because it is quite rare, and experts also find it challenging to physically meet with these children since it is hard for them to speak to new people. Most of the time, professionals talk to parents and teachers about it. If a child has a consistent inability to speak and interact for more than 1 month, then medical experts will diagnose it as selective mutism. Within the medical model of disability, selective mutism is seen as a negative obstacle that will heavily impact a child's daily living if this disorder does not get fixed by professionals. So, it is highly suggested that children take immediate medical treatments through therapy or medications. Behavior therapy and selective serotonin reuptake inhibitors, called SSRIs, are common successful medical treatments used for the disorder. Supposedly, 75% of children use an SSRI drug called fluoxetine to reduce its symptoms. According to an online article Susha Cheriadith wrote, selective mutism can be treated successfully since the prognosis is excellent in children and adolescents who receive timely treatment for the disorder. However, in the absence of medical intervention, the condition will persist and get complicated as affected children get older. Overall, the medical standpoints on selective mutism, as you can see, is to get rid of it as soon as possible before it can heavily impact the child and their future.
This slide is about social response. Historically, people with disabilities have been considered negatively. For example, people with disabilities are seen as inferior, and in other countries, they are thought to be possessed by evil spirits. People with disabilities are also usually excluded and patronized. Social misconceptions related to selective mutism are that professionals and teachers will often tell a parent the child is shy or they will outgrow their silence. Others interpret the mutism as a means of being oppositional and defiant, manipulative or controlling, or has autism. There's no relationship between selective mutism and autism, although a child may have both. Another false misconception is that a child with selective mutism has experienced trauma. There's no evidence to suggest that children with selective mutism are more likely to have experienced abuse, neglect, or trauma than any other child. A study named Debunking the Myth, Selective Mutism and Trauma by Bowden L. The findings indicate a significant difference between the percentage of children with SM who experience a traumatic event from those who do not. Specifically, the majority of children with SM in the present sample did not experience a traumatic event.
Okay, so this leads us to the end of our presentation. I'm pretty sure a lot of you guys haven't heard of selective mutism before, so we hope that our presentation helped you learn, understand, and become more aware of what selective mutism is and what it does to others. Thank you for watching and listening to our presentation.